早晨，大家好，歡迎大家嚟。
Good morning, everyone. Welcome to our ICON Health Forum, which is conducted in Cantonese. The topic is Stroke Smart.
First, we do lend acknowledgement. We want to say that UBC is located on the traditional, ancestral, and ceded territory of the Musqueam, and UBC operations are also on the territories of the Squamish and Tsleil-Waututh. We also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands.
我係何陳宇慈 Barbara Ho， 係一名註冊護士，亦都係安康健康網絡首席護理主任。今日咧，我係你大會嘅主持人。網上嘅朋友，大家好，歡迎大家嚟參加今日嘅安康線上中文講座嘅。呢個係誰有中風危機，應如何處理？
Now, simply put, I want to give you an introduction of ICON because some of you are first-timers. ICON is an initiative by the UBC Faculty of Medicine, the Digital Emergency Medicine, and the executive director is Kendall Ho. We've had this for 19 years. We also thank patients as partners, as our partners. We wanted to convey reliable and useful information to communities, to the indigenous citizens in BC, as well as family members and patients, provide them reliable and relevant health information on prevention and care of illnesses using technology so that they know how to manage, find technique to manage and lower the risks of having these illnesses. At the same time, we also will provide electronic apparatus, apps to the community to help them on improving health. Now, this is the last segment. It's about social resources in the community. We know that Translink itself has very good community resources to help us, not just those who have had a stroke, but also those who have chronic diseases, seniors. They can also use these services. We're happy to have Manager of Travel, Training and Public Affairs at Translink, Mr. Christopher Chan, to tell us something about related resources for management of stroke from Translink. Mr. Chan, like I said, is currently Manager of Travel, Training and Public Affairs at Translink. Before that, he was he was head of the new immigrants transport and services. So he has devoted himself to sharing public transport information with community members so that they know more about what's available in public transport. Thank you, Christopher, for taking your time and sharing with us what kind of resources there are available. Hi, Barbara. Hi, everyone. Thank you for inviting me to talk about how in the community, what kind of supporting services there are in the community. Mainly, I will talk about transport, or transit, okay, in the Greater Vancouver area. And after that, Barbara will talk about what other services are available in the community. Barbara, next slide, please. I will talk first about what services are offered by Translink. I believe most of you have heard of HandyDart. You may not know what HandyDart is, but you should have heard of it. HandyDart, what an animal, what kind of animal it is. Well, now, somebody call it HandyDart, another people call it bus for the handicapped. Now, this is a service offered by Translink, catered to those who have disabilities, who are handicapped. So they offer transport. Now, so this is a shared transport. It's like just any bus. It's not like you own the bus. You're the exclusive passenger, but it offers a point-to-point service. Many people may have some misconceptions about HandyDart, so I want to talk about those. Now, many people may think that HandyDart, or I can only use HandyDart. I cannot use other means of public transport. In fact, you can use HandyDart to link to bus or SkyTrain or SeaBus, or so if you live kind of far from a SkyTrain station, you can use HandyDart to take you there to the SkyTrain station. Another misconception is HandyDart is only for seeing doctors, for going outpatient, for medical uses. No, in fact, if you apply for HandyDart, register for HandyDart, you can use it to buy groceries, to have dim sum, to even watch Chinese operas. You can take HandyDart to those activities, as long as you have made an appointment beforehand or a booking beforehand. If you want to register or apply for HandyDart, now what kind of people are eligible? Now, some people have misconception about it. Many people think that only elders can do that.
A lot of times in the community, some senior people tell me, I'm 65, can I apply for HandyDart? Actually, it's got nothing to do with your age. HandyDart's users because of your physical or cognitive difficulty, and you're not able to use common transportation vehicles, that makes you eligible to apply for HandyDart. And the application itself, he has to be confirmed by your doctor or medical professional to confirm your eligibility. HandyDart users may be able to apply for a handy card. Handy card is a photo identity card, and this card could let you use Translink with extra help. Next slide. If you want to apply for a HandyDart, there's two ways to do it. Simply, one, you go online to get the application form, or you can call to our customer service 604-953-3680. You can call. If you don't know English, it doesn't matter. Once it's connected, you can tell them Chinese, please. They will get an interpreter to communicate with you. When filling the application form, you know that the form is for HandyDart and HandyCard. You can apply for both, or you may just need to apply for one. But you must remember, if you apply for HandyCard, you don't need to take a picture. If you look at the monitor on the right, there's an application form. There's a picture-like thing. If you're just applying for HandyDart, you don't need that. if you want to apply for a handy card, then you would need a photo, but you don't need to go to the store to pay for the picture. You just need your cell phone or get a friend to take a picture and email it to us. That will be fine. Handy card is for BC residents with disability that would enable them to some extra help when they take public transport. Next slide. Handy that has different types of trips. Most of the passengers would use what we call casual trips. Casual trips, you still need to pre-book, but it's not like you have to make the trip every week at a fixed hour. Like today you might use it for dim sum, or next day you visiting your grandchildren. You must have time limit to do certain thing at a different time. If you call to pre-book the service, you can call a week in advance or at least a day before to pre-book the service. But if you have some trips that you need to do most of the time, or you have to do it at a regulated time every week, if you in 3 weeks on the same day of the week at the same time you need to go to a certain place, maybe you can apply for subscription trips. Those trips has got firm time. For instance, if you every week at the same time you need to go for a follow-up, or at the same time you need to go to the community center for a certain thing, after a few months you could pre-schedule every Monday at this time I must go. So then they will, every Monday apart from stat holiday, they will help you schedule that trip. Next slide, please. Booking your trip. We said earlier, earliest you can do it 7 days before or up to a day before. Actually, 365 days a year you can call to make a reservation. But of course, the work hours may be different. Handy Dot also provides service 365 days a year. The earliest is scheduling for 6 a.m. The latest, last week, it was 12 a.m. But good news, from this week on, Translink will provide longer Handy Dot service. Starting from this week, you can schedule the last drop-off to destination at 2 a.m. If you want to pre-schedule, first you have to apply. After making your application, you can call 604-575-6600 to request a trip, or you call this number to change your trip. Next slide, please. Booking your trip, what do you need? You have to have your name ready, if possible, your Handy Dot identification number, what date you need the ride, what time, and pick up and drop off addresses. And you have to make some allowance for time, because we usually, for the scheduled trips, perhaps 15 minutes before or 15 minutes after, within that half an hour, so the bus may come. So the best time is not to tell them what you would like them to pick you up at what time. You have to tell them what time I have to be arriving at this location. Then our booking agent, our rep, representative will try to calculate for you how much time you need to make allowance for and the booking window, so you can ensure you can go to the place that you want to go. Next slide, please. Booking your trip, I said earlier, you have to provide some information. For instance, when the bus is at your home, how do you get into the vehicle, how to inform you. Especially for those people who live in apartments and high-rise is important, because a lot of people misunderstand that we provide a door-to-door service, but our bus drivers, they cannot go into your building, walk to the front of your unit to pick you up. We have to wait at the front entrance of the building. So if you schedule a trip, especially if you live in a high-rise, actually you don't wait in your home. You have to wait in the lobby for us. Also, you have to tell us whether you need any walkers or wheelchair so that we can make room for you. And if you have a caregiver accompanying you or a friend going with you, you have to let us know, because we have to make space, reserve a space for them. Next slide, please. Also, on the day of your trip, they will have phone calls to remind you of the pre-scheduled trips. The day before your trip, in the afternoon to evening, there will be an automated phone call to remind you that you have a handy-dart trip booked for the next day. Approximately what time they will be at your entrance or the place that you designate. There's a reminder to remind you that next day you have a pre-scheduled trip. Next slide. On the day itself, handy-dart would be 10 minutes before arriving at the place to pick you up, to make a phone call to remind you. If within that half an hour, maybe you are doing some other things, but before the vehicle arrives, we will make a phone call to remind you to get ready to leave, so that you have more time to get ready. But actually, you should try your best to be ready within that half an hour, so that you could leave, because the bus may be 15 minutes earlier than your scheduled time arrive at your place. Next slide. And I just said earlier, when you're getting ready to go to the vehicle 15 minutes before the scheduled time, the driver would use different means to get a hold of you. Sometimes maybe there's delay. If there's delay, if it's 15 minutes after your scheduled time, you still don't see the driver, you can call 604-575-6660 to make inquiries. You can also make this phone number if there's some sudden change. You could call to inform us. The earlier that you call to inform us, the better. Next slide, please. Actually, we have a guidebook. Each person applying for handy-dart, once they are permitted, they will receive a package. There's a guidebook and your number. If you apply for a handy card, they will send you the handy card, so you can understand our service in detail. So if you have any problem or question, you can go to our website or call our customer service number and ask us questions. What I would like to say today, that's all for today. Thank you, everybody, for giving me the precious time to share Translink and Handy Dot service. I'll hand it back to Barbara. Thank you, Chris, to taking time to let us tell us about Handy Dot service. I'm sure many people would be benefiting from it. You can ask your doctor whether you are eligible to apply. There's a community service you can see on the monitor. The family caregivers of BC, a couple of speakers had mentioned this service. Family caregivers of BC is through workshop and a support group. They provide some free resources, support to caregivers. You have the website and also the telephone number. Next. And then today, because we're talking about stroke, also there's a Heart and Stroke Foundation in the community. They provide multilingual healthy tip for prevention and recovery. Your Stroke Journey book. It provides critical recovery information to guide you and help you guide you and your family after a stroke. There's a website here. They have a new Chinese resources website. You can go browse that. Heart and Stroke Foundation also make this. Dr. Ip mentioned that's the most common symptoms of a stroke. A sudden onset, first face is droopy, not able to control the facial muscle. The arms, when the arms become weak, speech and not enunciating well, slurring your speech. So this make us, when we see those symptoms, because it's sudden onset, it happens suddenly. So call 911 right away. Don't think about making a rest.
And then we also have the Stroke Recovery Association of BC, and that also has services in Chinese, and it offers information to the community, the resources in the community, and also some recovery plans so that you can get back to normal life in your community. They have a phone number. No, it's only a web page. You can visit that to find out relevant information, which is also available in Chinese. Next. Now, we can see here that the Stroke Recovery Association of BC has information in simplified Chinese, so you can visit that. And there is also one from the provincial government, a platform called Health Gateway. This is electronic health record. Many of you may not have visited this webpage, but you can do that. And then you can find your personal, may not necessarily be your medical history, but at least what kind of doctors you've seen, what kind of specialists you've seen, all that information is available on this webpage from the government. So, yeah, just log on that page and then you can access the information, because all the information is confidential. So only the person himself or herself can access that. The next one, you can see when you have been to a hospital. You can find out about your medications, they keep records for many years. So any medications, any changes in that, any lab results, your immunization history, how many shots, how many COVID immunization shots you have taken, all those are available. Another kind of service is also offered by the provincial government, which is HealthLink BC 811. It's a tool to find reliable health information. You can do that either by calling 811, and then someone will answer the phone. Mostly nurses. There are also nutritionists, as well as pharmacists and doctors on the line. And if your English is not good enough to comprehend, you can ask them to speak to Chinese with you, and you can speak to Chinese with them, and you can just say, Chinese please, and they will find people who speak your language for you. Next, please. Here, when you call this number, HealthLink BC, that is 811, you can find answers to your questions, and then there are nurses who will answer your questions. If necessary, you can also ask them for, say, where the clinics that are closest to you, what's the address of the hospitals, or the phone numbers, and they can also give you that information. You can also go to their website to find out information about health, all kinds of diseases, illnesses, symptoms. You can find out on those web pages. Next. Here, you see the web page. You can jot it down. If in the middle of the night, a child gets sick, has a high fever, you don't know what to do, whether the child should stay home or whether the child should go to the hospital. If those things happen, when you cannot find your family doctor, then you can get that service. Next. Here we have the ways to contact us, icon. So if you have more questions, you can either send them by email at iconproject.org, icon.support@ubc.ca, or Facebook and other media. And we also want to thank the Ministry of Health, the BC Ministry of Health Patients as Partners Initiative for their continuing support. So after we have listened to the presentations, we have acquired a lot of knowledge about stroke. Stroke is preventable, it is recoverable, and it is curable. So now we have imparted knowledge in the community so that they can reduce the risk of suffering these critical illnesses. I hope that you can spread the information to other people, and you can also view these presentations again in future after they have been posted. So I hope you enjoy a healthy and happy life. Thank you. Bye-bye.